Healthcare team behaviors need effective healthcare teams to be engaged and committed to the overall success of the optimal patient outcome. And we want to make sure that we're setting goals and meeting objectives and that our goals are mutual. And patients and families should be included in this goal setting as well. We want to make sure we include them as much as we can in their plan of care. We want to make sure that we're sharing problem solving and decision making. We want to make sure that there's a consensus building and motivation. And we want to make sure that there's shared accountability, specifically when things don't go the way we planned it to be. And again, making sure we're getting patients, family, and staff all involved and accountable. So healthcare teams are accountable for their actions, but patients and their families are accountable themselves. You want to make sure that we don't have patients who are family members that are enablers or causing bad behavior, or patients who are not taking their health care seriously, and they need to be accountable for their actions or maybe bad habits that they're doing. Smoking, overeating, lack of exercise, not following their nutrition plan or their medications correctly. And we want to always make sure that we manage conflicts that arise in a professional way and that there's resources always available needed to do this type of team care building. Lastly, there are characteristics of teams. There's effective teams versus dysfunctional teams. And the effective teams will always have shared objectives. They'll work well interdependently. They'll meet regularly, and there's always mutual respect, and there's mutual goals as well as professionalism. In a dysfunctional team, you might see some absence of trust, fear of conflict or disagreeing with someone, a lack of commitment to the final goal, avoidance of accountability. You might see attitudes like, not my job, not my responsibility. Everybody needs to be accountable for that end goal. And an inattention to the results at the end of the goal to make sure that they were, the perspective was seen, that there was an optimal patient care that was provided. At this point, this is the end of week 1 lecture. As I stated earlier in the video, I will not be pre-recording any of the other following week lectures. You will just open up each week's content, read the corresponding chapters in your textbook. You will watch and read the PowerPoint presentations that correspond to each week's lecture, including all the notes that are on the bottom here to help supplement what you are seeing on the PowerPoint slide as well as what you read. And then again, you will take this information that you're reading and seeing on the PowerPoint, and that will be used in your discussion board post as well as your weekly quizzes. Feel free to email me or post on the discussion board any questions you might have regarding the readings, the PowerPoints, or anything else you might have questions about. And I will be more than happy to answer them for you and help you with this process. I know it's something different that we're doing here. So if you have any questions or confusion that arise, feel free to contact me. I wish everyone good luck with this course, and I hope that you get a lot out of it. And I'm sorry that we were not able to meet face-to-face, but I hope this course provides all the information that you need in order for you to move on to the next nursing course, which is 1010. Thank you very much.